So just to give you a bit of background on what this project has been involved in, I suppose this project, I suppose it stems from the Safeguarding Vulnerable Persons policy of 2014. So the process that's defined within that policy encourages this engagement between healthcare professionals, wider professionals in society to engage with our safeguarding and protection teams. And that's defined the process within our system. Very much the system is based on the as is. So in terms of the way the referrals are made within the system, it's based on the current structure of the CHO, which is the Community Health Organisations, the way the HSE has been organised. And we will move to a revised system once structures change within the HSE. So you will see that evolve over time. But if the current structure is based on the as is. The provider of the system is Liquid Logic. They've actually previously known as Liquid Logic. Now they're being acquired by System C, and they operate in this market predominantly in the UK, where they have over 50% of the safeguarding market, and they also have wider systems in health and social care. So they have a huge reputation in this field. In terms of describing the system, you have there's two aspects to it. We're going to talk about the adult safeguarding portal today, and that's something that you as professionals, both within health and wider, could potentially use. And how that feeds then that information that's received from the portal will actually be sent in to a case management system, which is the online system for adult safeguarding that's used by our safeguarding protection teams. So it's one feeding the other, and that's how that safe communication will happen between us. In terms of why change, I suppose it's really, really important that this new system is going to be a secure national system. It'll increase efficiency in how information is going to be sent between each party. It's also a cloud-based solution, so it's hosted in Azure, so that that enhances the threat of any cybersecurity issue that could happen. So it's a very safe, secure system. You'll see from the registration process, it requires two-factor authentication, which is and there's a code that's issued to you on each login. So it's a very secure process. In terms of, I suppose, it'll give us enhanced reporting because of the ability to be able to query all of the fields that are both sent into us and the wider case management functionality. It also incorporates IHI, which is the unique health identifier. So there's certain key information that we would ask for information coming in, which would enhance the information that comes out. So in terms of names, date of births, air code, all of these factors, gender, all of these lead to a match in IHI, which all lends itself to an enhanced national system. So it's going to provide a safer, standardised communication between both our HSE staff, our wider HSE and HSE funded services, and our wider network of interagency or referral colleagues. It's going to be faster and more accurate, and it's going to be more client-centred approach, and provide a standardisation from the team's perspective in terms of case management functionality. In terms of the workflow, what we're going to discuss today, so there's three aspects on the portal. There's three tiles that you can come on. There's the public, professional, and the services portal. The focus of today's discussion is on the professional portal. So we're going to look at that. And as Donal mentioned, it's quite similar to the public portal. So both of these differ significantly from the services side. So the focus is on public and professional. So these are cases that are generally once deemed to be safeguarding, would be managed by our safeguarding protection teams. Okay, so the logging of a concern via the portal, and then it comes into the team, where the team will actually make a decision if it's safeguarding or not, and then move it on through the process. Either, like, if it is safeguarding, then it moves into the preliminary screening and planning process. So just to welcome, this is the, in terms of the adult safeguarding portal. So this is the landing page of the portal. And I just wanted to first make you aware that if you do land on the portal, you don't necessarily have to create an account to be able to view some aspects of it. So one aspect is the reporting a concern. You've got safeguarding information, advice and contact, and then some portal help and support. In terms of the safeguarding information and advice, if you click on that, it will provide details in relation to our safeguarding and protection teams, information on training, and some background information on relation to vulnerable adults. Coming back out here to our reporting tile, and I'll go into the live system shortly, but I just wanted to show you what's possible even if you don't have an account. So, you know, I suppose our phone lines remain open, our teams remain contactable. So while the portal, we will be promoting the portal, there is always the opportunity to be able to contact our safeguarding teams for advice and support. So in terms of reporting a safeguarding concern, if you click on that tile, you're given the three options of public, professional, and HSE and HSE funded. As I said, the focus today is on the professional route, and as I said, we will encourage professionals both within health and, you know, wider in community to contact us, as has been the case since the service was established, where we would link quite closely with our colleagues within many agencies. So in terms of a login, when you click to, when you click on any of these icons like professional, you will be prompted to create an account. So either to log in with your existing credentials or else to register an account. If you're registering an account, you click on this icon here and you're brought to your registration page where you'll have to provide your name, your surname, and some details of your address. What I would encourage you to do is, if you're working in a professional capacity, it's your professional details that you will be recording at this stage. You can see there where there's a red asterisk that notes that there's mandatory fields that need to be completed. Then you will be asked for your email, again, encouraging you to complete using your work email. Then you will be asked for a password, and you need to confirm that password, and there will be a match, you know, very similar to other systems that you potentially have used in the past. There is some detail on the side there in terms of password policy, what's appropriate in terms of length, characters, and so forth that you can utilize. Okay, and then each time you register, you're going to be asked for an individual. You'll be sent through your email an individual code. So I'm going to switch now to the system and be able to show you how that actually operates. Okay, bear with me just for a moment. So in this stage, I'm going to log in using my credentials and okay, so once you put in your email and password, then you shortly afterwards you will receive a code and input that. And once the code is in, then you're able to progress. Just to note, and I will show you as we go through, you have the ability to be able to save within the portal. So if you start a safeguarding concern and then you are pulled away on something else, you have the ability to be able to save, and you can come back to it at a later stage and complete. So that will actually save in your draft items for 30 days. So I'm actually receiving now my code, so I'm just going to enter that. So it's going to enable me here to start a new submission. So I'm going to click on the professional tile. I'm going to proceed this way. So first of all, you're just given there's going to be some information, just some guidance here. And then next you have to select the CHO as most appropriate. So I'm going to select, in this case, CHO1, because that's the route, it's a concern relating to concern in that region. So it's going to show me some details on how the tool works. So basically you're proceeding down through the items on the left of screen, how the tool works, your details, adult risk of abuse details, details of the concern, the ability to be able to attach any supporting documentation, and then submitting the referral. As mentioned, you need anything with an asterisk. That symbol denotes that you need to complete the field. You've got the ability to be able to save as you go, and you can, as I said, that will remain within your saved items for 30 days. And once you submit something, it remains in your submitted items for 90 days. You also have the ability to be able to print a form, and you can also save a document as a PDF, which may be something that you might need to do for internal records. Okay, so moving on here, you can see those options all available at the bottom. So first of all, my details will always come up, and just to verify, if there was any details that I had a problem with here, I will be able to go here and I can update account details and I could change those. Okay, so I'm happy with these details, and I'm going to just say that the source of this contact is, in this case, I'm going to say it's a public health nurse, and I'm going to say the contact method is via the portal. So I'm completing it. I'm completing it. I'm not completing it for myself, so I'm completing it in a professional capacity. And I'm going to say that my name is Annie Ryan. I'm sorry, the client's name is Annie Ryan, and I need to record either a date of birth or an age. It's one or the other. So I have actually Annie's details, which is great. So I'm going to record those. Next thing, we'll proceed to Annie's gender. Okay, so we don't actually have a telephone. We don't have an email address for her at the moment. Those details aren't mandatory, but beneficial if you have them. The system is based around air code, so there's a mandatory air code field. So if you fill out this and you go find address, it will automatically populate an address. Okay, if the person is in receipt of a service, you can document that service. For example, if it's a day service for older persons or disabilities, or if they're receiving any sort of respite care. In this case, Annie isn't. And does anyone live with the person? We're going to say yes, in this case, and then we have to say who that person is. So she's living with her daughter. Then I'm asked for to provide any brief description of the vulnerable person. I'm just going to copy in those details there, and you would document if there's any communication or support needs. These again are mandatory fields, but if it's not applicable, you can just put in not applicable. Are other services involved? Say no, and then we're going to move on. Then we're proceeding then to provide details of the concern. Again, there's standardization around this. You have a calendar function to know when the concern arose. You click on that calendar function and we'll say the concern arose yesterday. We're going to say it relates to physical and emotional, that the location of the abuse is actually in Annie's own home. And she is aware, the public health nurse has discussed it with her, and she's aware that the concern is being raised. And then we provide, the public health nurse is going to provide details in relation to the concern. So there's some kind of little guidance there, just to provide as much information as possible. Then you need to document, what is known as the adult's wishes in relation to the concern. So it may be that, maybe the person causing concern is actually someone who's close to her, and there could be, some considerations in relation to that. So is it deemed at this point that there's ongoing risk? So we're going to say that there is, because their living status. Okay. So she's actually living with the person who's causing concern. In relation to capacity considerations, if there are capacity considerations, you document them. Otherwise, you say, no, there are not. So in relation to the details of the person alleged to be causing concern, there is some information here just around the necessity of that information and responsibility in providing it. In this case, we're going to say that is Brenda, and we're going to say as above. And then we're going to say what the relationship is. So it is an immediate family member, and is the person aware that, so yes, I'm going to say that they have been spoken to. In relation to contact details, this is information that is desirable. It will be beneficial for the team. So to provide details of the names of GPs. In this case, it is the public health nurse making the referral. So we will put in some logic into that. We're just still developing, but you might just document, you know, I would be putting in my name as the public health nurse. But we will need to include some logic. So this is all information that would assist in the team in being able to deal with concern and knowing where to go and what healthcare professionals to draw on. I've also included kind of other professionals, so there may be somebody outside of health that could be involved with the person. For example, if it was something in relation to financial abuse. So we'll progress this. Then you've got the ability to be able to upload a document, so you can attach a document at this point. And they're like standard documents that you would upload. And then progressing next. And as I mentioned, once you send the referral through and submit, you can go here into my submitted forms, and Annie will appear. So you have so as I mentioned, you've got this, so any submission that is made on the portal, it will show as a no response yet in terms of the submission. And then once it's received and seen by the team, that will change to received and under review. So there's the status changes in time. So all of anything that you have made in terms of submission is here to be viewed in the recently submitted forms. As mentioned, if I go to my saved forms, these are anything that are in draft that I'm able to progress. So just to give you a moment, I'm just going to go back into the home page, and just to, as Dawn mentioned, on the public side of things, the fields are very, very similar. So it's just really in relation to, just going to give you an example. It goes through much the same things. It's how the tool works. Then you progress, your details come up in relation to the portal, and then you're completing the details in relation to the adult abuse, at risk of abuse, the details of the concern. You won't be asked for the professional involvement to the same extent, the supporting documentation, and the submit referral. So it's very much the step-by-step process that we explained for the professional referral. So these processes in many respects replicate one another. They're just more mandatory fields in the professional referral. So I'm just going to go back here, and I'm going to stop sharing here for a moment. I just want to go back to some commentary in our presentation. So in terms of the summary of key points in how to use the portal, the URL for the portal is going to be published in advance. We go live on the 23rd of September. So in advance of that, and on that day, we will be publishing both on our website and through our kind of our usual communication channels. So once it's live, we would encourage all professionals to create a portal account. So professionals reporting concerns should use their work email and work address. Ensure, as in the case example of what I just went through there, ensure you have access to your email when you're logging the concern, because the two-factor authentication will mean that the code will come into your email. So you'll need to be able to access that to be able to populate. And the code expires quite quickly. So, you know, you need to have access and log it. In terms of the details that you log within a concern, you need to, I suppose, maximize the information that you provide the teams with. And this assists in, you know, being able to give locations of where people live, their date of births, their proper, you know, their appropriate name, their surname, all of this information. The more information that you feed in, the easier it is for the team in being able to identify and match potentially that client in the system. As you would appreciate, some of the adults at risk of abuse that we are dealing with can often be on the move, you know, within the country, and it's important that a national system can track that movement. So that's why the integration of IHI is really, really integral to the success of the project. So we need you to provide as much detail as possible to assist the teams. You know, again, for professionals, we're asking you to, you know, provide details on other professionals that are involved with the person, because, you know, within the system, we can build on those profiles and be able to see the wider picture. Remember that you can save the information in draft, and that will remain there for 30 days. So, you know, that's of benefit to you. And that all forms that are submitted remain there for 90 days. And you have the ability also to be able to download a PDF to save any submitted document for any of your internal records. So once you're within the submitted documents, you can click on any of the submissions that you've made there, and you will be able to see and save as a PDF. So that facility is available to you. In terms of, as mentioned from the outset, you know, the safeguarding and protection teams are available to you to provide advice, guidance and support. If you have any queries, we also will have information available to support the use of the portal, like a user guide in relation to the portal and indeed these recordings. So we'd encourage, you know, anyone who's going to be using the portal to first go and access that material. And if they encounter any difficulty, certainly the National Safeguarding Office is available to you. So you can address any queries to safeguarding.socialcare@hse.ie. And if you put adult safeguarding portal in the subject line, we will be able to address that.